Good morning. My name is John D'Amico, and I'm chairman of the Niagara Board of Trade and Commerce, and along with the Niagara Chamber Partnership, which includes Fort Erie, Grimsby, Lincoln, Niagara Falls, Niagara-on-the-Lake, Thorold, Port Colborne, Wainfleet, Welland, Pelham, and West Lincoln. I'm thrilled to be, this is our second session for this informative series. This time around, we'll be focused on 6 issues that are impacting our Niagara business community. We will be presenting you with 6 thought-provoking conversations featuring local perspectives. These conversations will allow us to reflect on changes and opportunities and hopefully some new thoughts. I want to thank our speaker, our tech sponsor, B4 Networks. Thank you to Brian LeChapelle and your team. We are certainly incredibly fortunate to have John Armstrong from Armstrong Communication, a longtime champion for our local chambers, as the moderator for this series. I'm looking forward to a great conversation, the same as the last one. And take it away, John.
Thank you very much, John. Hopefully it's not exactly the same as the last one. No, I'm just kidding.
Better.
Yeah. Thank you very much. And I certainly like to welcome our guests today. We are talking, as Dolores said, we're talking about the state of our public health, as well as our mental health here in Niagara. We follow really quite a fluid format and see where the conversation and the discussion takes us. We are joined today by Dr. Mustafa Hirji, Niagara's Acting Medical Officer of Health and Commissioner of Public Health, Nancy Garner, who is the Executive Director of the Quest Community Health Center, and Matt Miller, who is the Principal of Grimsby High School. Welcome, everybody. So why don't we, there's obviously, the news is virtually the COVID and other stuff. Dr. Hirji, you certainly have been called on many times, probably almost virtually daily, to be commenting on the state of the pandemic here in Niagara. One of the things that I think is interesting or important for us to really put into some context is really the state of the public health system here in Niagara, and as well as the state of the public's mental health, because certainly mental health has been featured prominently, and the impact of mental health on the population through the pandemic more widely is something of extreme importance. We spent a fair bit of time at our last session talking about that from a business perspective and a human resources perspective. Today, we're talking about it from a health perspective. So why don't you start us off, and maybe you can provide us with a little bit of context about how you feel the public's mental health state is in Niagara. If you have any, I don't know if you have any data, or if you can share some reflections on that.
Sure, I can share a few thoughts on that. So, I think everybody is well aware of the pandemic itself, the infections, the unfortunate deaths that people have suffered, and the really quite, unique and, extraordinary activities the government has taken to restrict social activity in our society, to limit that spread of infection and really prevent many deaths, and really protect our healthcare system from a surge of hospitalizations. And I think we're seeing in Alberta what happens when you don't take some of those measures. But I think obviously all of those measures themselves have a side effect. And I think the pandemic and the virus itself has a side effect on people. And some of those side effects are people are, restricting their social activity. That's going to affect their mental health, their mental well-being. It's going to also affect some of the economic growth we may have. You're going to have, businesses restricted, people's livelihoods affected. Many people perhaps lost their jobs. That's going to have a real direct impact on people's physical and mental health, because we know the conditions in which people live really is the biggest driver of their health. And, we unfortunately, one of the things about this pandemic is that because we have been so all in, particularly in the public health sector, but in a lot of other parts of health, to really just manage the acute part of the pandemic, we don't have as good data collection on what some of those side effects are. And I think, one of the legacies of the pandemic is we're going to really see how bad some of those impacts are. And it's going to be years before we fully recover. just to show you a few, quick bits of data we have here. The Canadian Mental Health Association last year did do a survey to understand what people were thinking about their health. And about 38% of people at that time said that their mental health has declined due to COVID-19. And that's, of course, only about a year ago. So we're only looking at the first wave. We're not really looking at the impact of the second and the third wave, and really another 12 months of this activity going on. Another area where I think it's very apparent to us is when we look at opioid overdoses. In 2019, we had 90 deaths from opioid overdoses. And at that time, I thought we felt we were really kind of cresting that curve. We were getting a handle on this, and we'd hopefully over many, many years, but eventually be able to drive that number down. Unfortunately, March 2020 hits, the pandemic hits, and we see a big increase in those deaths. And unfortunately, we had 150 people die in 2020 from opioid overdoses, up from that 90 the previous year. And in the first 3 months of this year, we had 47 deaths. And so that means we are perhaps tracking close to 200 deaths for this year. So another 30% increase or so. And I think that's, a direct consequence of how the pandemic has affected people's mental health, and unfortunately is driving more substance use, and unfortunately more unsafe substance use. And those are some of the stats that we are seeing.
Nancy, you're the executive director of Quest Community Health Center. I know community health centers look after the most vulnerable populations in our communities. I was on the board of the Niagara Falls Community Health Center for many, many years, and I love the model. But maybe you could tell us about some of your experiences, either related to data and/or putting a human face on the issues that Dr. Hirji was just talking about.
Most definitely. Thank you. Well, certainly we really observed firsthand how COVID-19 impacted everybody in our community, particularly those, I would say, who already face so many barriers, such as social isolation, food security, and lack of digital equity. So we were able to, right off the start, figure out how we can reach out to our vulnerable populations and ensure that they felt supported, even though they were truly isolated. And so we realized that a number of people didn't have access to a phone to be able to connect to us and to their other supports. So we connected with TELUS, and they were able to give us some SIM cards, and it's really great to have a bunch of young staff on your team, because they want the latest and greatest phones every year or two. So they've got a drawer full of phones that they were able to donate to us, and we were able to get phones out to people who didn't have a phone, so that they could reach out to us and at least have that access to be able to connect to supports. We went online with all of our groups. So we quickly shifted to put all of our groups in a virtual platform. So we were looking at anxiety, our quit smoking group, our skills to cope group. We added new groups. We had tea time with our dietitian. We had to connect with in looking at food security, we partnered with small scale farms, and they were and continue to be a strong partner with us in being able to provide fresh produce for individuals. So we go and pick up the produce, we bag them, and we deliver them to our clients who really are don't have access to fresh foods and healthy foods. And sometimes it means that an individual or a family, the difference between having food at all or not, or having food. So we're very fortunate to be able to partner with them. So just looking at all of those areas of need and shifting and figuring out how to address those needs.
I know that certainly at the beginning of the pandemic, the donations to food banks, for example, went up significantly. People rose to the occasion. You're talking about food security obviously as another key issue. Are you? But as it relates specifically to the mental health conditions of the patients and clients that Quest sees. Have you noticed things have declined over the last over the course of COVID? Or do you find that things are getting better? Do you find that things are getting worse, Jeff? But what's your thought?
Sure. So I would say that the folks that we have served who live with chronic and persistent mental illness continue to live with chronic and persistent mental illness. And so those supports that we would provide we've just shifted to a virtual platform in meeting with those. I would say that going out to our points of service in the community, so going out to the streets, going out to the jails, withdrawal management, and all of those different points of service, we had to decrease that access initially, and then we've increased. So in fact, we've actually received funding to be able to increase our supports, to be able to go out and see people out on the streets and make those connections and get them connected to some primary care and other supports that they would require. So yes, there's now an increase of access to for our urgent services access team to be out and making those connections. So yes, and as Dr. Hirji said, we don't have any idea what the full impact of the pandemic will be on our community's mental health status. So I think we're just seeing the very beginning of where things may go.
Mm-hmm. Certainly, I definitely want to get into the discussion of funding and balancing the notions of adding additional funding with the human resource challenges and the staffing problems that we face, and how we balance those out, or how we traverse the funding to get the people. But before we do that, Matt, obviously our young people have been affected in very unique and dramatic ways at very important periods in their lives. What experience can you bring to the table in terms of reflections on the mental health of young people, both I guess during the pandemic, when people were out of school? I know we're still in the middle of the pandemic, but while people were out of school, but now as students and in fact teachers return to the classroom, how's the pandemic affecting your year so far?
Yeah, like I would divide it into a series of events similar to the others who've spoken before me around our initial response and our current response. Initially, it was a matter of pivoting to online learning for classroom teachers. It was a matter of supporting students for our student support staff who they have to connect either electronically or by phone, providing electronic devices to students who needed them, providing internet access to students who needed that, really taking care of basic needs and just trying to get the learning happening. That was the initial part of it. I mean, as you said, at this stage, things are different now, and we're seeing a much more normal return to school than we have. Fall sports are up and running, albeit correctly run with the COVID protocols that need to be in place. Same with activities, student leadership. Like, there's a very positive feeling in the air, I can say, of our school particularly, that kids are back to doing the things that they like to do, which is being here at school. We're 97% in person ish right now. And, the number of students who are showing interest in these outside the classroom things that we're now able to offer again is very significant. And that's great. It creates some, logistic things to deal with, because if 80 kids want to come out for junior volleyball, we just can't have them all come out and have an open tryout like we would have done once along the way. But that's a great problem to have and deal with, to have such interest in these extracurriculars and sports. People watching them, people there, like, yes, we're following a bit of a different set of rules than we used to follow, but it's well worth the attention to detail to get people back doing the things that they like to do.
Yeah, so there's certainly been a lot of attention, rightly so, to to some of the dealing with some of the physical challenges related to COVID and the social distancing and the air quality and those types of things and wearing masks. So there have been a lot of physical accommodations to the to getting back to school. Has the school board or do the schools or teachers they taken any kind of mental health accommodations to also get into the return to school mode? Because sounds, it sounds like things are going well, which is fantastic. At the same time, there's got to be some anxiety. There's got to be some anticipation. At least I would think. Maybe I'm wrong. Within a relatively sizable segment of the student body that and teachers, quite frankly, that might need accommodation as well. Is there anything happening on that?
Sure. I mean, accommodate. I'm not sure what you're asking around accommodation, but in terms of, in line with what Nancy said, there are students who struggle with things like change and social situations, and all, that still is the case. And we've had more change over the last couple of years, probably than in the last 100 years of schooling, realistically. So people who struggle with change or feel anxious around periods of uncertainty certainly are going to be supported, and we have those in-school supports, both as a youth worker and a social worker, youth counselor and a social worker here in the school, which they maintain caseloads as in every year, and I would say it's often difficult to draw a straight line between a particular circumstance and why a student might need support. But yeah, like we're all in the same boat, whether we're in education or in business. It's changing times and uncertainty and different ways of doing things. But I would say overall, students have been very, very adaptable. And, in terms of masks, like you mentioned, very few reminders. Kids are great and they know what to do and they want to stay healthy just as much as we want them to. So that I would say that's been a minor thing for us.
Right. So sounds like there are no special accommodations. I'm not saying that that's good or bad. I'm just saying it sounds like there are no special accommodations. And I know accommodation is a loaded term. So let me I didn't mean that in the loaded sense of the term. There's been no additional resources applied to deal with the mental health challenges that may or may not appear. I'm not sure whether you think that that's because they whether it's too early in the year to know what kind of an impact that's going to have over the longer term, or what's your thought? Or is it?
Yeah, no, I know what you're asking. I just think it's a bit hard to quantify that in all cases. In terms of what, like we have resources that students access for a variety of reasons, and same with staff. They have an employee assistance program that they're able to access, and I wouldn't know if they are or aren't. Right, that's confidential information. But yeah, like I think people are dealing with it in schools as well as they are in every other walk of life. Like people have their challenges, kids and adults, and as school administration, we just try to support each of them where they are and give them what they need to be able to come to school and learn and feel comfortable and safe. And yeah.
So certainly we had a fascinating discussion last week related to the workplace and the one human resource consultant who was on the call, whose name escapes me, and I apologize. But she talked about the psychological contract that an employer has with employees, which I thought was really a fascinating description that got us into a really interesting discussion about what that level of responsibility is. So I really just kind of providing that as comment, a sort of additional comment to what you were talking about, Matt, and sort of what are those responsibilities that the school system has to students, and again, like I said, and that responsibility to teachers as well, as everybody kind of reemerges into the workforce and into the school system.
Yeah, I mean, people can't learn or teach if they're feeling unsafe or, a lot of these other things impact. So we try to provide supports to each person so that they can do what they want to do and are meant to do here at school, which is learn or teach and be part of the process. It looks different in the case of each person, but some of those supports are unchanging where, for example, employee assistance, they've always had access to that and continue to. And it comes down to relationships, right? We want to talk to our teachers a lot and talk to our students a lot as school leaders and make sure we have a good temperature of our building and know how people are feeling and be able to guide them to the right supports when they need them.
Right. Dr. Hirji, excuse me, there's governments have been really stepping up in many ways, lots of different ways, lots of resources, lots of support. We're also hearing about a lot of staff shortages and people unable to fill roles. I've just recently joined the board of Albright Manor long-term care and have been learning the long-term care world and sort of watching or observing the kind of staff shortages that they currently have in the system throughout long-term care. And then I know how that then ultimately then backs up the hospital system as well, because that winds up with people in hospital beds that should be moving to long-term care, and it just cascades down the system. What kind of an impact across the system are you observing as well as in public health, observing as it relates to staff shortages and the ability of the system to continue to cope and ultimately adapt?
Yeah, and I think there's sort of two different things going on here. And I think you alluded to one, Albright Manor, they're a kind of seniors home where you could have an outbreak that could be quite severe. When you have an outbreak, of course, lots of residents are going to be potentially at risk, and so we'd isolate them. They'd be isolated in the home. But a lot of the staff who are potentially at risk of developing infection or who actually are infected need to be sent home and isolated, which of course all of a sudden makes you short-staffed when you actually have more work to do because it's now an outbreak. And so when we have those outbreaks, it becomes this huge pull on what little resources we have left in our healthcare sector, creating kind of these, acute draws. And it's often very difficult for those long-term care homes, retirement homes, other settings to really find the staff to be able to do it, which I think has caused some of these outbreaks to last quite a long period of time and sadly see some of the real tragic human costs that we have. And so that's, I think, one big area where we do see that shortage. I think part of that is, of course, a bit of chronic underfunding of long-term care homes, retirement homes, where they maybe don't have, as much staff as ideally we'd want. They're kind of operating on the bare minimum to get by, and that bare minimum is not enough when there's a pandemic or an outbreak or the like. The other thing you're having, though, is a lot of healthcare facilities recognize that given the pandemic, given the risk of outbreaks, we want to maybe have some more staff in reserve and actually try to, be better staffed during this period of time. As well, they recognize that if we invest more work to infection prevention and control, to doing things to prevent outbreaks up front, that's going to save us from that crisis down the road. And that, of course, means they want to hire additional staff. So some long-term care homes, retirement homes whose owners are willing to hire additional staff are doing that. Hospitals are definitely hiring additional staff. However, on top of that, hospitals have to treat all the COVID-19 patients. So that's a new disease, a new group of patients they have to treat. So they also want to add staff for that. We in public health have been intensely busy. So we have hired a whole bunch of staff in terms of case and contact tracing, control of outbreaks, communications, vaccination. All of that has been additional staff. And what's really happened is that I think our health sector is completely tapped out at this point, that there's no more people left to hire. Everybody who can be hired has been hired. And I think one struggle we particularly have in Niagara is that our wages aren't necessarily as high as parts of the GTA, where historically there's been a higher cost of living. And so we are seeing some of our healthcare workers in Niagara being bled out to the GTA, which creates yet another source of pressure here. And so I think the state we are in is actually, we're all struggling to get by with, the limited staffing resources available and still trying to do all the work that we need to do to manage the pandemic. And then, particularly when a crisis like an outbreak hits, really trying to manage that as well. And I think, one of the things that this really, I think, illustrates is how we maybe need more resources in the healthcare system to deal with these kinds of surges in the future. The one other thing I'll add here is, of course, the pandemic is going on for 19 months. In a lot of settings, long-term care homes, hospitals, public health, which have been extremely busy during this period, there's quite a bit of burnout of staff. And there are people who are leaving, who are leaving the profession, leaving their sources of employment, and of course that just adds to the pressure as well.
Right. Nancy, what are you experiencing on the ground in primary care and in community health centers? Is staffing turning into an issue? Is it an issue? I know historically sometimes community health centers have problems finding physicians. Is it something that you're continuing to experience and or anticipate?
Well, currently we're in good shape with regards to physicians and nurse practitioners. So I'm very relieved with having that stable staff team. However, we have had to hire additional community outreach workers and RPNs. RPNs are very challenging to find right now to kind of complement our wraparound services. As you know, we provide primary care to the seasonal agricultural workers in Niagara, and so we had to really to find RPNs and to work in partnership with our community health workers was a challenge, and I think from what I hear, it's a challenge right now to find nurse practitioners. So as Dr. Hirji said, I mean, people are tired and people are leaving the field or moving down the highway. We had one nurse practitioner go to Toronto. We were lucky enough to recruit for that position. But I concur with what Dr. Hirji said. I think the system itself is suffering. I know instructors at Brock University in the Bachelor of Science in Nursing program. They're saying that students coming into that program this year, because they were learning online independently in their final year of high school, that they're having to do some additional kind of catch-up work with those students. So it'll be interesting to see the pressure in the educational system that's going to put out these additional primary care staff as well. So there's so many pressure points throughout the system. I think time will tell and what we will be seeing.
Yeah, certainly the in terms of mental health workers, whether it's psychologists or social workers, I know community health centers often rely on social workers to fill some of those roles, and counselors in the school system. There's been a long-term shortage here in Niagara in those resources. However, we have got certainly the experience Dr. Hirji was talking about, sort of the escalation in the needs as it relates to mental health and addiction services, because the two very often go hand in hand. Are there any additional strategies that are being put in place? I mean, certainly the provincial government has talked a lot about infusing substantial dollars towards mental health during the course of their mandate to date. It was a key plank of the provincial government's election. It's been a priority of all governments. But again, we've got those human resource problems on the staff side as it relates to mental health. What are you experiencing or hearing anything from your perspective, Dr. Hirji?
Haven't heard a lot. Certainly the government, sometimes makes announcements of, additional funding to a hospital or to a mental health, program out in the community. And certainly those are positive. The one thing I want to highlight, though, is that, once you're at the stage of treating a mental health problem, you're kind of, at the last point of the line. And you really should be trying to, what we would say in public health, work upstream to prevent those. And what we know is that 60% of our health outcomes are really about the socioeconomic and the environmental conditions in which people live. And so I think if we want to be really serious about improving mental health, what we really want to do is make investments to address some of those. And I know Nancy, of course, is her organization, Quest, really deals with some of that work upstream. We want to really try and, help people have, get them into proper housing, address homelessness. We want to make sure people have the skills to get a good employment. We want to make sure young children get a nurturing, supportive environment, because all of those things actually down the road lead to mental health problems. And if we can address it at that stage, it's going to actually make a lot bigger impacts than perhaps funding additional mental health beds or psychiatric beds, downstream.
Right, Nancy. What do you think? I mean, certainly you deal a lot with that population. And of course the pre-existent trauma or the trauma that many of your clients have also faced probably multi-generationally as well, or intergenerationally.
Yes, so definitely we all know that in Niagara there's a real lack of safe, affordable housing. So that's had a huge impact on it's really challenging to be able to do some good kind of trauma informed therapy and support when somebody's homeless. So having those other pieces in place, having a safe place to live is key. Having a source of income, having food security, all of those social determinants of health are key to increased mental health. And so we see this on an ongoing basis. We have peer support workers who have lived experience, who have experienced homelessness in the emergency rooms in St. Catharines and Niagara Falls hospitals, making connections to people who identify as homeless and providing them with education and supports, and trying to connect them to at least a safe bed or a shelter bed so that they don't end up back on the street when they leave that emergency department. So, I mean, we are trying to look at different ways of addressing the need of the homeless individuals in our community, but it's a sheer lack of resource within the region. So that's a much bigger problem that requires a different approach for sure.
It's an important consideration, though. I mean, you make a very good point, and Dr. Hirji, you do as well. Can you just, for the sometimes we talk in code for the people who may be watching, either Nancy or Mustafa, could you just maybe give us a bit of a rundown on what the social determinants of health are? First off, what is it? What does that mean? And then maybe a bit of what are they?
Sure. So, I think that's really exactly what I was explaining previously without using that phrase. The social determinants of health recognize that the social conditions in which we live are the biggest driver of our health. The Senate of Canada did a study on this a little over a decade ago and quantified it as about 50% of health outcomes are the socioeconomic conditions in which you live. Another 10% are the environmental conditions. And then that final 40% is the quality of healthcare, the genetics, the biology you're born with, all of that. So the 60% are the conditions in which you live, and that's what we can change. And that's really the social determinants of health. And I think what we in public health are always trying to do is highlight that that's where we want to invest our resources, because if we put the money there, we can definitely prevent a lot of these downstream costs on our healthcare sector. Obviously, though, there's going to be a long-term investment there. It's not going to be realized for a while, which is, I think, why we have to think about it as an investment, because the dividends are going to be paid down the road.
Right. Matt, what's your experience in the school system? Can you do you see that on the ground, that those people who may be facing more disadvantage are also facing more challenges in their across the board?
Yeah, I would say that's always the case, right? That's the cycle of poverty, is knowing that it's difficult. If you're in a disadvantaged position, it makes it even more difficult to deal with some things that other people have more supports for, and that's really part of our mandate. And when we're looking after kids, right, we have a no surprises mentality, and we try to get referrals from teachers around students who are struggling with any number of things, or families who are struggling with any number of things. So we can then take that information, and at our weekly in-school team meeting that I think every school pretty much runs, make the correct referrals to the right supports, whether they're community or school-based, and make sure that people are attached to everything that we know can help them. So whether that's community nutrition, whether it's mental health support, we have connections to all those either through school staff or our school social worker, and we're able to connect people.
Yeah. So Dr. Hirji, one of the other things that I think the system may be anticipating as well. I'd like to have your reflection on that too. So I know certainly the in some other work that I do, the insurance industry has been waiting to see whether or not there's going to be a mental health tsunami and a dramatic increase in mental health claims through the health benefits system. Certainly, it's been something that they'd seen escalating quite dramatically. It's over the pre-pandemic, and they're anticipating it to continue to grow. They're also anticipating an increase in claims as it relates to chronic disease, other kind of physical chronic diseases, not just mental health issues. As a result of a lot of people avoiding healthcare services, and therefore things being left untreated, undiagnosed, and left to become people their health being worse. Are you expecting that, or are we expecting anything like that to happen in Niagara? And what would be and how do we deal with that, if so?
Yeah. I don't necessarily want to use the language of tsunami because I don't know how big it's going to be. I'm hoping it's not going to be quite that bad, but I do definitely think that we're going to see more of some of those issues. Now, some of this I think is, actually our society missing some of these in the past, particularly with mental health. I think there's been a lot of stigma, and part of the increase of claims isn't that mental health was increasing, but more people with mental health were actually coming forward and getting the help that they need. And so that's certainly, I think, a good thing. But, as I talked about, at the start of our talk, some of the statistics we've seen in terms of people feeling that their mental health is worsened, hard statistics in terms of opiate overdoses increase. I think it's going to be many years before we correct some of that. So absolutely, there's going to be more mental health. And then with some of the physical health issues, I think absolutely there's people who've, because of the pandemic, because they're perhaps scared of getting COVID, maybe haven't gone and done some of the things that would have, helped prevent some of their physical health issues. There's been a lot of surgeries, a lot of healthcare procedures that were canceled during our various waves of the pandemic, when all resources had to be really shifted to treating COVID-19 patients and not really dealing with some of those other issues. But I think, again, talking about the social terms of health, this pandemic has been a very difficult time socioeconomically for a lot of people, particularly for those people who already had the worst socioeconomics to begin with. And I think that correlates with health outcomes, both mental health, but also physical health. And so we're going to see an impact of that, I think, in terms of some of the physical health impacts that we see. So I do, very much expect that we are going to see more both physical health issues and mental health issues in the coming years. I think interestingly as well with COVID-19, there is a scenario of long COVID where some people don't really fully recover from that and have long-term persistent symptoms. Some of those are actually cardiac symptoms and turn into potentially chronic diseases. And, it's at least 10% of people suffer from that. And there's some estimates arguing that maybe actually we've underestimated, it's actually going to be higher than that. And that, of course, adds a whole nother dimension to that. So I do think it's going to be many years, unfortunately, that we are going to see kind of this long shadow as a legacy of the pandemic of terms of health impacts. And hopefully, as a society, some of the resolve we had to address the pandemic will hopefully carry forward to make sure we make the investments to address some of those issues as well.
Yeah, I know that certainly during the pandemic, that the provincial government was and public health organizations as well were encouraging people to actually get outside and get active and to stay physical. I know as it relates to chronic physical and mental health conditions, actually, that there are a number of risk factors that make you more inclined to get a chronic disease like diabetes or heart disease or many others, as well as on the mental health side. I'm the chair of the Ontario Chronic Disease Prevention Alliance. So I know that the risk factors for getting a chronic condition include physical inactivity, poor nutrition, smoking, excessive alcohol use. Combined with that is the relationship with mental health, because those risk factors exacerbate each other as it relates to mental health, and then of course the social determinants of health being the lens. We've heard a lot about how people's just their general physical health status has also declined over the course of the pandemic. With I can't remember the expression for the weight that people have put on, and their physical activity declining. We've heard about alcohol use escalating as well. Not sure about the smoking numbers. Actually, that would be interesting to know. So do you think are there measures that are being put in place to help to deal with some of those risk factors from a public health perspective? I know public health is very active in that prevention space, or at least has been to date. I know there's some potential changes coming from the province. What do you have thoughts on that, Dr. Hirji?
Yeah, one of the things we try to do in our local public health agency here in Niagara is, when the pandemic hit, recognizing that 70% of our health outcomes are actually the non-communicable diseases, the chronic diseases, the mental health. We really tried to preserve the teams working on those issues and not necessarily pull them all into working on the COVID-19 response. And so we've tried to preserve some of the work that we're doing there. I think, though, that we've kept that work kind of preserved and equal. And of course, it's a lot of what they do is, of course, connecting with individuals, connecting with communities, which was very much disrupted by the pandemic, with a lot of that moving virtual. So, at the very best we continued on, it probably wasn't as effective at a time when, of course, we are seeing increasing stress on those conditions. And so, I don't think we've necessarily really been able to keep up with the need in the community. And I think that's something that's, again, going to be post-pandemic, we're going to have to reckon with, because I don't think the resources really are available in the system to work on all of those chronic diseases and increase our effort on that, while at the same time managing the acute impacts of COVID-19.
Yeah, I mean, I guess from the longer term perspective, certainly. Yeah. Like you say, the upstream social determinants are probably the most upstream. Than dealing with the risk factors are probably that a little bit more downstream. Do you think that what do you think the impacts of of changes in public health that the province has been considering, sort of the consolidation of health promotion and that kind of thing? Those going to be positive, negative, or neutral from what you see right now? That's probably a tough question for you.
Yeah, that is definitely a tough question. I think pre-pandemic, the province was definitely moving down the road of trying to consolidate public health services to a smaller number of geographic units, but larger geographies they would cover, and really align us much more closely with the healthcare sector. It seemed to us that a lot of that was driven actually by cost savings, because a lot of it was tied to actually then reducing the amount of spending they'd have in public health. After this pandemic, I don't know where that is necessarily going to go. I'm sure the provincial government is still very interested in reducing the costs of healthcare. That being said, I think post-pandemic, we are going to have some big reviews of what was Canada's pandemic response like. What were the strengths, what are their weaknesses, what are the changes? And I think any kind of change in the public health sector is probably going to be delayed by a few years until we actually see some of those results, similar to what happened after SARS, when there's a whole bunch of big reviews after that. Where that leads us, I don't know. I do think there is some role for perhaps broader provincial integration in recognizing some economies of scale. However, at the same time, I think one of the things the pandemic really highlights to me is how important having that local lens has been. Because our experience with the pandemic was not the same as Hamilton or the same as Toronto or same as somewhere in Northern Ontario. We had unique circumstances here, given our geography, our population. For example, to pick on something like migrant agricultural workers. That was a big focus. So for us, we had lots of outbreaks associated with that sector. We had to work with organizations like Quest to really be able to put the healthcare services in place for that. If you're looking provincially, where you may cover, a lot of areas that don't have migrant agricultural workers, are they really going to have the knowledge to do that? And are they going to have the local relationships with something like Quest, where they can actually work with them to put in place the healthcare support and the measures in place to, make sure, these workers are able to get assessed if they do have symptoms of COVID-19, get tested and all of that. So I do think there's a very strong role for a local presence to continue, and I hope that isn't lost when the province and the federal government do their reviews of this pandemic.
Yeah. So Nancy, what are you experiencing on the ground in Quest as it relates to chronic physical conditions? As people are starting to go out more and maybe doing some more in-person health visits, and a little bit of that fear because of our vaccination rates are doing well, not as well as they should, but they're doing well. Are you experiencing an increase in chronic conditions, or an increase in, I don't know what the word is when it's more greater severity, greater acuity? I'm not sure what the word is. As it relates to chronic conditions, do you have what are you experiencing?
Well, certainly, because of the individuals that we serve here at Quest, they typically do have chronic health issues and pre-pandemic. So, I think what we've done is we've been able to identify those people that we need to see in person, and get them back in here and get them reassessed, and put a plan in place to moving forward for all of those individuals. There are some people that we can touch base with virtually and still maintain that primary care quality of care for them. But I just think as Dr. Hirji was speaking, I was also thinking that the pandemic, I think, really allowed, there's some silver linings here. So what it has done is allowed us to really solidify some of those relationships in the community. For example, with public health, we worked very, very closely with public health with the outbreaks on the farms, and then doing the follow-up with those workers who tested positive, and looking at being creative in how we were reaching out to the numerous farms in Niagara, as well as identifying that group as a priority population for vaccine within the vaccine task force, and so really looking at those local needs while still following provincial directives. So I concur with Dr. Hirji around, it was really important to work really closely with our partners, and that I think moving forward, those relationships are stronger, and processes are in place to have a better system within the Niagara region. There's other pieces, though, that I think that we didn't really touch on, and I think that are important, are that when people are forced to isolate throughout the pandemic, primarily, I would say, the greater number of women who are in relationships that are abusive and can't get away and can't get those supports that they need. I suspect that we may see some next steps needed for supports with those individuals that perhaps we haven't really thought about very well, and I think that that's a piece of the healthcare system that we were going to need to focus on as well. I know that we've had received calls from people from their cars because they couldn't speak in their homes honestly and openly because of the perhaps an abusive partner in the home, and had to go outside or go somewhere else where they felt safe to be able to talk about their healthcare issues and their challenges that they were experiencing at that time. So I think there's another sector of the population too that will be seeing needing additional supports.
You know, does public health probably doesn't track any of that kind of data? I wouldn't expect. Do they?
Yeah, we wouldn't directly track it. We'd really rely on other organizations who track it.
Right, and the organizations that probably that work in the system. I mean, that's a super important point, Nancy. I mean, the confinement has been a challenge for everybody, but when you're in an abusive relationship, I just can't even imagine what that experience would be. Just before I move over to you, Matt, and ask you about the circumstances related to those risk factors of diet, exercise, alcohol, and smoking in the youth sector, I just wanted to close or not close, but ask Nancy and Dr. Hirji whether or not I know it's a slightly different kettle of fish, but Niagara has been working with its Ontario health teams, working to create its Niagara health team, and a lot of that has to do with building those relationships and building those close relationships. Is the kind of conversation that Nancy and you and Dr. Hirji were just talking about related to farm workers. Does Niagara's Ontario Health Team have an opportunity to help to facilitate those kinds of connections that you were talking about that were so critical? Maybe do you have a thought on that, Dr. Hirji?
Yeah, I don't think the Ontario Health Team is necessarily creating new connections. I think probably all of us already have connections with each other. What I think it's hopefully trying to do is organize us around, a few shared priorities that we would then all work together on. And I think it's really a forum to enable that. And, some resources, of course, coming from the province to hopefully support some of that. So an example of what's going on here is right now we actually are doing a bit of a system mapping of our mental health sector, figuring out what are all the different services offering mental health service, who are they serving, what kind of service they're doing, so you can understand what is the full spectrum here and what are the gaps, where are the opportunities for greater alignment, and then we can hopefully build a more cohesive mental health sector so that people who are entering it have it, something is more easily navigated, and that as they're handed off between services, they don't feel like they're lost. They actually get a much more seamless experience. And so I think that's an example of the kind of work that the Ontario Health Team has started doing and hopefully be able to continue doing if it continues on as something the province funds.
What do you think, Nancy?
I agree. I mean, there are the system is disjointed, so I think this is an opportunity for the providers within the system to really figure out how we will work together and really have those care pathways much more seamless for anybody entering in, for example, the mental health system or any other sector of the healthcare system. We're just looking at ensuring that people get the supports and services that they need when they need them, and I think that's the ultimate goal of the Niagara Ontario Health Team. So it's a huge undertaking, and working on smaller initiatives will help build that.
Yeah. So Matt, sorry about that. I left you for a while. I apologize. But I am interested in any reflections that you might have as it relates to the additional risk factors for developing chronic conditions for young people. Certainly, as I said, the related to poor diet, physical inactivity, smoking, and excessive alcohol use are. It's probably too early for you to tell. We certainly saw on the news some wild parties that were happening at the university systems at McMaster, and I can't remember, there was one other one, but and we're also experiencing some additional unrest in the university system at Western. Are you experiencing anything at the high school level?
Well, I mean, I think we're experiencing less as time goes on and kids are able to do more. Like, that's really what it comes down to, is we're able to safely roll out extracurriculars, sports, activities, music, all the things that keep kids busy and physically healthy. Like, there's an intersection of those two things. I mean, we also see community sports and organizations sort of following along a parallel path in terms of kids being able to engage with them. And, you know, it's not super complex. If kids are busy doing the things they want to do and active, and we provide those, like, we're excited about, you know, the hopefully future reinstatement of intramurals at our school, because we know that not every student is a competitive athlete, but might want to be active with their friends. And every little thing we can do in a safe way, a COVID safe way, and make sure we're providing every possible opportunity for kids to be active and be, you know, quote unquote normal at school. That's really what our mindset is get back to normal safely and as quickly as possible.
What are you hearing about intramurals? Are they? Is that coming?
Well, we're not at the place where we can roll it out yet. We're working on that. But sports, I would say we've had double the number of kids come out for sports teams, and, you know, coaches, as a result of that, taking maybe a larger roster than they normally would, so that kids who would have missed out otherwise are still being included and able to practice and develop moving forward, which will be to everyone's benefit. Yeah, like, kids are speaking with their feet very loudly that they want to be involved at school in a variety of different things.
So we only have a few minutes left, so I'll ask the big impossible question just to wrap us up. So I'll start with you, Dr. Hirji. If we had to prioritize one thing to tackle right out of the gate ahead of some of the others, what would you recommend that we tackle, and how would you recommend we tackle it? Small question.
Yeah, that's tough. And, you know, the answer I give here shouldn't be the definitive one, because ideally I'd want to go back, look at the research data, come back with something that's really well thought through.
Right.
But I think, you know, off the top of the head, if I was going to pick something, I would say let's address, you know, homelessness and quality of people's housing. I think if you can get people into good quality homes, that gives them a stable base in terms of improving all of the other socioeconomic conditions, which is going to lead downstream to their, you know, having better health. Of course, having a home means you have a safe place to be. It means that if there is, you know, a spreading of infectious disease like a pandemic and the advice is to stay home, you actually have a home to stay in. So I'd pick that as maybe the one big thing that if we, you know, dealt with, could make a huge impact.
Terrific. That was a great answer. Nancy, what are your thoughts?
Well, having spent most of my career in working with individuals who are homeless with mental health and addiction challenges, I concur with Dr. Hirji. But I would also say that some education needs to happen with regards to our opioid crisis in Niagara. I think that that's another piece that we really need to tackle. We're seeing that parents are now writing honest obituaries, and so that they're actually talking about the deaths of their loved ones, and so just reducing the shame around mental health and addictions. There's a huge educational shift that needs to happen. We all are touched by mental health and addiction challenges in our lives, and so that would be my piece to add to that.
Terrific. That's wonderful. Thank you very much. And Matt?
Yeah, a lot of what we're doing is what Nancy described. Like, we have a healthy action team that's really working on the education side of things with students from a peer-to-peer basis, along with the normal curricular learning that kids do about those topics. We have student mediators that are being trained in restorative practice so that they can work with their peers in a safe way around, issues that they're having. And of course, the huge role educators play in getting to know their students and bringing their concerns back so that we can support them. Like, it's a very integrated process, but, empowering students to be an active part of that, I think, is going to make a huge difference long term.
Wonderful. That appreciate everybody's time. That's all the time that we have for today. Very much like to thank our guest, Dr. Mustafa Hirji, the Acting Medical Officer of Health, Nancy Garner, the CEO of the Quest Community Health Center, and Matt Miller, the principal of Grimsby High School. We are off next week and not having a session due to Thanksgiving. We give people a break. Then on Tuesday, October the 19th, we will be returning where we'll be having a conversation that focuses on the economy and where it's heading. Our guests for that include David Sordas, the Senior Account Manager for BDO, Patricia Seuss, who's a Senior Manager from Durward Jones Barkwell, and Dr. Stephen Tupp, the Chief Economist for the Canadian Chamber of Commerce. I'd like to thank all of our guests again, and I hope to see you on October the 19th. Thank you so much, everyone. Bye-bye.